So hello everyone, my name is Steph Moir and I'm the Community Initiatives and Training Coordinator for the Hawaii Public Health Institute, and we're joined today by Claudia, and I'll let her introduce herself.
Aloha, hi, my name is Claudia Hartz. I'm a lead community health worker at West Hawaii Community Health Center.
Thank you, Claudia. So I wanted to start our talk off today. So we'll be talking about community health workers, and I wanted to start by defining it. So according to the American Public Health Association, a CHW is defined as a frontline public health worker who is a trusted member of and or has an unusually close understanding of the community served. This trusting relationship enables the worker to serve as a liaison, link, or intermediary between health and social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. So locally, we see CHWs going by many different titles. It's community outreach workers, patient navigators, community health educators, and when I worked at Kokua Kalihi Valley on Oahu, we called them our super aunties. So we know that CHWs are trusted members of the community, and they often live in the communities that they serve. So some background, Hi-Fi has had the honor of working alongside CHWs for about the past 2.5 years. We serve as an ally organization, and our role has been to help facilitate meetings and conferences, secure funding for capacity building and workforce development, as well as general support for the CHWs in Hawaii. The current CHW Ally Group is comprised of several organizations, including Hi-Fi, along with Department of Health, Hawaii Primary Care Association, Papa'ololokahi, American Cancer Society, the University of Hawaii, Kapi'olani Community College, and most recently we've added some new members, which we're really excited about. We have a member of the Kauai Fire Department, as well as the Healthcare Association of Hawaii. And we're always looking for other organizations to join the Ally Group. So as I mentioned, I help facilitate our monthly CHW Zoom meetings, and the CHWs are currently working toward the formation of an association. So right now there is no formal association in our state. And although this conversation began many years ago, it most recently picked up with a strategic planning meeting that we helped facilitate in August of 2018. This meeting held really rich discussions on the definition of a CHW, how the allies can foster our relationship with the CHWs, and how to expand our reach to those CHWs who are not currently involved in the movement. The brainstorming continued through our Zoom meetings and culminated at our conference, which was held in 2019, where we had over 100 CHWs present. Since then, discussions have been ongoing through our monthly meetings, and we were kind of advancing on the plans, getting ready to form a website and all the content that would go there. But as we know, the pandemic really threw a wrench into things. So due to COVID-19 related closures and mandated stay-at-home orders, pretty much all association discussions really came to a standstill in April of this year. Many of the CHWs were forced to redirect their energies to help clients, communities, and organizations around the new pandemic that we're facing. We know that CHWs are a vital part of the healthcare team and are frontline workers in their community. As new information was being announced, it was their responsibility to get that information into the community. Having never faced such a time, CHWs are really having to learn new roles almost as fast as they are being implemented. So we're now seeing CHWs, very busy educating the community on how to stay safe. Some have learned to do temperature checks at the entrance to their clinics, and others have really had to change the way that they're interacting with their patients. Some were used to having a lot of face-to-face interaction, but with the stay-at-home mandates, we've seen that change from face-to-face to all communication over the telephone or also telehealth. I'm excited to have Claudia with us today to really share her experience as a frontline worker and community health worker. So I'll go ahead and turn it over to you.
Thank you, Steph. Thank you. I'm a part of an amazing team of 3 community health workers and 3 enrollment specialists here at West Hawaii Community Health Center. We serve the west side of the island from Kauai High to Ocean View, which is an 82-mile radius. And today I'd like to talk about and share the wonderful work that we do here at West Hawaii, especially during this time of COVID. As many of you know in the healthcare profession have experienced that there was nothing to prepare us for this pandemic. I'll share with you a timeline of events that I and my colleagues experienced. On March 12th, the nursing supervisor asked for Spanish and Marshallese translation of COVID screener sheet with questions. These questions were to be used before a patient walked through the door to determine if the patient should be seen in the COVID tent or safe to go inside the clinic. This team translation was completed within 12 hours. Spanish and Marshallese, questions we are all now familiar with and have memorized. Do you have a fever, cough, sore throat, shortness of breath? Have you traveled in the past 2 weeks? We started to do more research on our own, COVID education, reviewing the Center for Disease website, which we were unfamiliar with the virus, and started to hear the rising numbers across our nation. We printed COVID brochures from the Department of Health locations from different states across the country to get familiar with what we would be sharing with our own communities. The next day, on March 13th, all of our classes and outreach events facilitated by community health workers were placed on hold. And on March 13th, that same day, we started to screen all patients before going into the clinic. If the patient was having difficulty breathing, then we had the outdoor tent set up for an exam and screen if needed, if they needed a test. We didn't know at that time that the translation and the education that we had worked on was actually for us to continue to use and also keep us employed. And for that, we are very grateful and thankful. We also provided farm safety health education. So we attend farm safety meetings where we provide COVID education. We've gone out to local farms. We have spoken to 85 farm workers on one farm, including languages in Thai, Spanish, and English, where we talk about social distancing and symptoms and prevention. Also, due to layoffs, our enrollment specialists have continued to be very busy. We have employees from resorts, rental car offices, local restaurants that come here to seek help to apply for medical insurance and need help with the unemployment and other community resources. We continue to be active. Now, fast forward to August, where we're currently at. We continue to work as screeners. We provide health education on the COVID to the farms. Coffee season has started, and last week we tested coffee pickers that were recently arrived from Central Mexico and California. They followed the quarantine guidelines and then test 14 days after arrival. Community health workers are trusted members of the community, and we are allowed on farms to provide education. And it's not easy for other organizations to be allowed on farms. And this month, the goal is to provide education to 3 local farms. I also want to share as CHWs, we go with our intuition with patient encounters or community encounters. So if you see a nurses wearing PPE, then we recommend that we wear the same outfit PPE. For example, I was in the COVID tent this morning helping with interpretation, and I followed the nurse and doctor wearing a full protective gear. Also in our community, setting the example and wearing our mask when we're out in the community. People see us wear our mask when we're in the stores or over at affordable housing, and we model that, and our families follow our example. Another thing that I like to share is that we're all human, and as CHWs, it's okay to speak about our feelings with our coworkers and community. It's been challenging times and times of uncertainty where we're uncertain about what will happen, and we've all experiencing some grieving stages. COVID has significantly changed our lives, and we've gone from the shock and the denial of COVID, thinking it wouldn't happen to us here in Hawaii, the bargaining with a higher source to take this away, the loneliness that we feel sometimes with missing our families in order to keep our elders and our kapunas safe in our communities and in our own homes. Some challenges that we've experienced when a Marshallese or Spanish-speaking community member is tested positive, since we live in multifamily homes with only one bathroom, and trying to keep the rest of the family isolated has been difficult and challenging, where it puts the entire family at risk to get COVID. I have one scenario right now that I could share, and it's with the increase of migration from Central Mexico, from Central America, from Honduras and Guatemala and Central Mexico. We've noticed our numbers going up with Spanish-speaking patients. So as a community health worker, I'm used to interpret and also to follow up. And a lot of our Central Americans are seeking asylum. When you're seeking asylum, you need resources, right? Immigration resources, lawyers, how to book a flight from Big Island to Oahu for immigration court, explaining transportation. And these are things that, as a community health worker, we have the time and the knowledge to research where the doctor does not. But more than ever, our community trusts us. We are frontline. We're using our FaceTime on our cell phones, our phone calls, text messages, social media, and providing education in our own language. We continue to link community with the abundance of food resources going on, from school lunches to keiki, to sharing toilet paper from one neighbor to another. Connect and hire more community health workers, because they are the ears and the eyes for the medical provider. We know the barriers that our patients go through and cannot afford their medication, or why they were just laid off of work, or situations going on at home, stressful situations. Then report back to the nurse or the doctor, so then they understand why the patient has these challenges or struggles. It's not that they are not compliant with their medical care, is that there are other social determinants of health that we have to look at. And as a CHW, we are out there and can help identify those. And this is just a little brief of what community health workers here in West Hawaii have done. And thank you for listening. Thank you. Go ahead, Steph.
Thanks, Claudia. I couldn't echo more what Claudia has just said. CHWs are the eyes, the ears, the trusted members of the community, and it's imperative that they be utilized during this time to ensure that the social needs of communities are being met. Like Claudia mentioned, whether it's getting masks into the community or getting food to kupuna in need. We're all learning to live in this time of a pandemic, and we, I think, looking back to March, had no idea how long this would last. And here we are in August. Still, a lot of us are still staying at home. We are seeing the spikes in cases. We had a record high today, over 200 positive cases. We need, as communities, to rely on our community health workers as frontline workers to provide that education, to distribute the meals, to provide cultural resources too. We see other community health workers and organizations providing la'au lapa'au as aid to help in spiritual healing, which I think is just beautiful. So I can't say enough. Now is the time to integrate community health workers into our workforce. Hi-Fi as an organization, along with our other ally organizations, will continue to support the CHWs through this pandemic and beyond, especially on their journey to creating the Hawai'i Association. I want to encourage you, if you are interested in becoming or joining the efforts, whether on the CHW side or the ally side, to please contact me. My email is stephanie@hifi.org. So that's STEPHANIE@HIPHI.org. And I want to thank Claudia for taking time out of her schedule to share your story of what it is to be on the front line with us. I also want to thank Greg Kishaba and the Workforce Summit for allowing us this platform to share this information with you. Turn it over to Claudia for any last thoughts that you want to share.
Yes, thank you. Thank you, everybody, for listening today. It is very important, our role as community health workers, and we enjoy doing this every day. It's what gets us up in the morning. And as Stephanie mentioned, we live in our community, we know our community, and bridging our community to community health services and any barriers to health is what's important for us. Thank you.
Thank you.